Right, good evening everyone, and welcome to our webinar here at Benenden Hospital on hip osteoarthritis. My name is Damien and I'm your host for this evening. And this evening our expert presenter is Mr. Kumar Reddy, Associate Specialist Surgeon. Now this presentation will be followed by a question and answer session. If you'd like to ask a question during or after the presentation, please do so by using the Q&A icon, which is on the bottom of your screen. And this can be done with or without giving your name. So please note that the session is being recorded if you do provide your name. If you'd like to book your consultation, we'll provide contact details at the end of this session. So I'll now hand over to Mr. Reddy, and you'll hear from me again shortly. Thank you, Mr. Reddy.
Thank you, Damien, for your introduction. Good evening, everyone. I just would like to give you a brief presentation with regard to osteoarthritis of the hip and what is a hip replacement, why people need a hip replacement. So if I do a brief presentation, it would allow you to put some questions, and hopefully I should be able to give you reasonable answers today. I'm one of the surgeons here who is practicing hip and knee orthoplasty for the last 15 years in Benenden, and overall my practice has been for the last 25 years. And in total, I would have done at least approximately 10,500 joint replacements. I've been a locum consultant in University College London Hospital for a period of 4 years, and where I've been having the most experience in doing complex revision surgeries. And we're going to talk about the symptoms relating to hip arthritis and the treatments that are available for these type of condition. And I'm also going to talk to you with regard to the types of hip replacements that are available, and also briefly with regard to the bearing surfaces of the hip replacement. Benenden Hospital is a leading provider of private hip treatments in Kent. Hip replacements are done in laminar flow theaters, and we got an experienced team of my colleagues who will come in the next slide. And Benenden Hospital has achieved high satisfaction rates, and also with the rapid recovery program. These are our team of colleagues who are well experienced with hip and knee orthoplasty. Alex Chipperfield, who is now the medical director, and he's one of the lead hip and knee orthoplasty surgeon, and he has done his first robotic knee in Benenden Hospital. You'll be pleased to know, which went successfully well. The next one is Mr. Dunnett, who also is a very experienced hip and knee orthoplasty surgeon. And other one is Matt Oliver and Raman Thakur. All of them are consultant orthopedic surgeons at East Kent hospitals, and they provide at Benenden the hip and knee orthoplasty service. And with regard to hip arthritis, what is arthritis? It is an inflammation of the bone, and it is a disease that commonly affects the joints, mainly the hip and knee. And these are covered with smooth articular cartilage, and over a period of time, this get damaged, and you're left with the areas of bare bone without any cartilage, which results in pain and stiffness. What are the causes? Natural age and familial predisposition is a major factor. and obesity and any trauma related. When you get an injury to the hip or when there is a subchondral fracture following injury, you can develop arthritis. High level impact sports is also a contributing factor for development of arthritis in any joint. The other conditions being psoriasis, gout, rheumatoid arthritis is another common condition where people can develop degenerative arthritis in the joint. Coming to the symptoms that one can experience, usually when I ask them what are the symptoms, people come up with the pain, stiffness, inability to walk any distance, even walking short distances is becoming a challenge to them. And also they express, when you ask them, having immense difficulty in cutting the toenails, putting the socks, tying the shoelaces, as well as getting in and out of the bath, in and out of the car also can be a challenge. And sleep is constantly affected because of the pain. And people also sometimes express that they have got crackling sensation in the hip, along with the weakness in the muscle. They can't lift the leg up because of the stiffness. The muscles would not fire up and they go into wasting and become weak. And clinical examination, when you do an examination, people will have extremely limited rotational movements, which are again acutely painful. With regard to treatment options, you can take pain relieving medications such as simple paracetamol, codeine, and non-steroidal anti-inflammatories like ibuprofen, naproxen, which can be useful. Again, they do have side effects where it can upset your stomach and it can upset your kidneys. So one has to be mindful and careful of taking these ones on a long-term basis. Next is lifestyle changes. One can reduce weight by going on weight loss programs and see whether we can reduce the weight that would offload the joints. The next one is a steroid injection. Again, these are not recommended on a frequent basis. 1 or 2 injections at the most would be beneficial. And there's also a risk of losing the blood supply to the ball of the head, thereby resulting in avascular necrosis. One can put some hot and ice packs, physiotherapy, and heel wedges or special insoles you can use. And also walking stick, using a walking stick opposite side of the affected hip also can be beneficial. And when all these conservative methods of treatment, including physiotherapy, painkillers, steroid injections, or hyaluronic acid injections, fail to improve your symptoms, the next step is going to be a joint replacement surgery. A joint replacement surgery is mainly to relieve the pain and to improve your quality of life. And with regard to hip replacements, the primary hip replacements are nearly about 100,000 that have been carried out in UK in the last year, and mainly done for osteoarthritis. And I hope you're aware that hip replacement surgery is the second best operation in the world behind cataract surgery, and 96% of the patients are happy with the outcomes of the hip replacement. With regard to hip replacement, the hip joint is a ball and socket joint where you got the pelvic bone, which contains a cup-shaped bone, which is called acetabulum, or a socket of the bone. And you got a ball in the thigh bone, in the top end of the thigh bone, which is the femoral head. So I can show you on the picture where you can see this is the socket of the pelvic bone, and this is what we call it, acetabulum. I hope you all can see in the picture. And this is the top end of the thigh bone, and you can see the hip being inserted into this thigh bone, and on the top of the neck you put the ball, which is a ceramic head, or you can put in a metal head. And again, these are uncemented and cemented implants depending on the surgeon and the patient choice. The main aim is to relieve the pain, reduce the stiffness, and improve your ability to walk and to get back to your normal activities. Again, do I need a replacement of the hip? Certainly, one may benefit when your pain limits your day-to-day activities of life, and also your recreational activities like playing tennis or golf, and your walking distance, if it is significantly getting impaired because of the pain, certainly you would need a hip replacement surgery that would benefit you, provided all the conservative methods of treatment have failed to improve your symptoms. I've explained to you earlier what types of hip replacements. You got cemented hip replacements where the implants are being cemented, and you also have uncemented implants. With uncemented implants are usually hydroxyapatite coated, which is a type 1 collagen. This encourages your natural bone to get osseointegration, and it would bind it like a glue rather than the cement. And you also have hybrid total hip replacements where the socket is uncemented, and the thigh bone would be cemented where you put the stem in. Both have got very good data of the last 30 years, and majority of these hip replacements, they last minimum 20 years or more. And with regard to the timing of surgery that people generally ask, how long does it take? It normally takes about an hour duration, an hour to hour and a half. So majority of the patients do have spinal anesthetic, which is an injection in the back to numb the legs, and they give you some sedation so that you won't hear any noises of the saw or the hammer. Usually nowadays the discharges are pretty quick, and majority of the patients, they stay in the hospital for a day or two, and as soon as they're up and about and are given a green signal by our physios or OTs, they'll be discharged home, as they are better off being in their home environment rather than being in the hospital. So I've earlier told you it is basically replacing the arthritic parts of the socket, as well as your top end of the thigh bone, the femoral head, by doing this hip replacement. So patients are encouraged following hip replacement to get up and walk as quickly as possible with the help of our physios, and either the same day, if I do the surgery in the morning, our physios are very enthusiastic in getting up the patients by afternoon, and they'll get them up, encourage them to get them going. And our OTs are also there to help you with regard to the do's and don'ts that you're supposed to do following hip replacement surgery. So if you got stairs at home, our physios are very helpful in making you do the stairs. And once you're safe to go home, then only you'll be discharged home with a pair of crutches, if you can use, or otherwise a Zimmer frame. And you'll be shown how to use them safely in going up and down stairs. In general, people do need some painkillers to start off with, especially at night time, to get you comfortable sleep. And usually about 3 to 4 weeks time, people tend to get rid of the crutches once they regain confidence. When we do the hip replacements, it's like for patients to develop confidence and to walk again. So once you develop confidence, you can get rid of the crutches indoors quickly, and outdoors, I would say, within about 4 to 6 weeks. And the potential risks and complications of surgery are one, deep vein thrombosis, which is a 4%, and also where you can develop clots in the veins of your leg, and sometimes they can migrate into the lung and cause a pulmonary embolism. That's one of the reasons why we give each and every patient following hip replacement surgery um, 35 days of anticoagulants, mainly to prevent thrombosis in the leg or in the lung. And again, the risk of infection. And I'm pleased and proud to say that Benenden Hospital have got very low infection rates when compared to any other national hospital or national average. The other one is dislocation, where this is a ball and socket joint. The ball can come out of the socket and cause a dislocation. And in majority of the times, the risk is very low, probably 1 in 1,000. But when the dislocation occurs, usually we tend to treat them very early and to get back in the right place. So, and one can experience leg length discrepancy. One leg can be slightly longer or shorter than the other, but up to 2.5 centimeters, people can accommodate um, uh, within few months. And if necessary, they may be given some insoles in the shoes to match for the leg lengths. Next one is a neurovascular damage. People can develop some numbness, and also foot drop can occur. Again, it's a very rare entity, 1 in 1,000. And people can develop periprosthetic fractures while doing surgery. And again, when the surgeon come across, we tend to stabilize then and there during surgery. And loosening of the implants. After a period of time, these implants can become loose, and where we might have to redo them again. Again, the aseptic loosening of these implants, or the incidence is very less in the first 20 years. Again, with regard to NJR, it's a National Joint Registry. It's a tool to monitor the surgeons and also to monitor the implants that we use. And all the implants that have been used in Benenden have been time tested over the last 30 years. And this majority of the implants, they last minimum 20 years or more. And they do have a good ODAP rating with regard to these implants. And even the public can have access to the surgeon's profile, how they're performing in the last 10 years, and their volume of surgeries. You can see them, and also their complications you can visualize on the NGR. If you wish to see a small brief video from one of our patients who had a hip replacement, I'm happy to share it with you. So can.
If you hover over it, should.
I'm Jean Woods. On January the 30th, 2023, I self-paid for a complete hip replacement on my left-hand side. I was in quite a bit of pain. It emanated from the groin, but it was also on my back and on some days down to my knees. Benenden were very, very good at making contact. I had a series of emails and the pre-op assessment, and from there everything went very well indeed. But I would like to say that I personally was very anxious. On the day of the operation, however, the anxiety reared its head again. Benenden are outstanding and absolutely amazing. The schedule was changed so that I could go into the theatre first, as he said to wait several hours would not help me. It was absolutely excellent. Benenden maintained contact and wanted to know my feelings or thoughts on quite a few issues. Regarding after the operation, I was absolutely staggered at how quickly I was up out of bed, and the physio was there a few hours afterwards, and I was actually taught how to use the crutches, and again people were patient with me. Well, it might seem a simple thing to some people, but I can actually tie my own shoelaces. It's wonderful, independent again. But not only that, my life is back to where it was. Benenden will do their utmost to make you feel at ease and help you through this journey from start to finish. Truly, I don't think it could be bettered.
Right. I'm just going to pass it on to Damien before I answer your questions.
Yeah, thank you, Mr. Reddy. Yeah, really interesting. Thank you very much. So yeah, please use the Q&A icons for questions, and we've got some rolling in now. So we've actually got Teresa Morgan. This is a typical question that I'd ask as well, actually, being a bit sporty. Is it better to continue playing tennis with this condition or stop it until treated? I don't know if she's referring to a complete hip replacement, but what are your thoughts?
If you do have arthritis in the joint confirmed on the plain imaging, I think any impact activities, it's going to progress your arthritis. So my recommendation is, if you do have a lot of pain, just wait until you have your hip replacement, and then you can carry on after 3 months. That would be my sincere advice if you got proven arthritis in the hip.
Yeah, no, perfect. We've got an anonymous attendee who has asked why steroid injections are not recommended. I think you had a limit on them, didn't you? Why is that?
I mean, steroid injections, you can give one steroid injection into the hip. Mainly, if you suspect early arthritis, it would certainly help in relieving your symptoms. The first injection is always the best, and subsequent injections may last about 2 weeks to about 6 weeks maximum, and you'll be back to square one. And the risk of giving a steroid injection is, once the pain is relieved, you tend to load them more, and it becomes even more arthritic. And the other reason is there is a risk of avascular necrosis, where the blood supply to the femoral head or the hip joint gets lost, and your femoral head can crumble sometimes, resulting in avascular necrosis of the hip, where you may then need an urgent hip replacement.
Okay, understood. Yeah, so we've got Jill Horton. She mentions that she had minimal degeneration, loss of the left femoral acetabular joint subchondral cyst. Is this enough for hip replacement?
Right, Jill. With regard to this subchondral cysts and femoroacetabular impingement, for a hip replacement, you need to be in significant amount of pain. We see with even earlier degenerations, you have some subchondral cysts, but at the same time, patients come and say that they're happy to live with by taking some paracetamol or so. In that case, I would allow them to do it. But if you got a minimal degeneration on the plain radiographs, it's worthwhile trying an injection under image guidance or fluoroscopy or ultrasound guidance, which may help in relieving the pain. But one has to be really realistic that these are temporary measures. And in the long term, you may well benefit from a hip replacement surgery if you already have got a degenerative process with the loss of joint space and if you got multiple subchondral cysts.
Lovely. Thank you, Mr. Rennie. We've got another anonymous attendee who has asked that she doesn't believe she's at the hip replacement stage, but never gets through a night's sleep without it being interrupted due to pain through knees and hips. Any advice or pre-bed exercises?
That's why we stand here to help you guys. And diagnosis is crucial in this type of conditions. We need to establish if you got a pain radiating from your buttock up to the knee. First thing is we need to rule out whether you got any back problems, whether there's an impingement of the nerve that is causing you these symptoms. Once we establish the diagnosis and once the radiographs or the MRI scans confirm that you got significant arthritis, yes, you may benefit from a hip replacement surgery, but not until you've been diagnosed where the symptoms are arising from. We have to rule out whether it's coming from the back or arising from the hip.
Yeah, okay, lovely, thank you. We've got Kalama Malden who's inquiring about scars and where exactly is it and how big will it be?
It is basically centered around the hip joint, mainly around the prominence of the bone called greater trochanter, just about 3 to 4 centimeters distally and 3 centimeters proximally. I do, and a couple of my colleagues also do minimal invasive surgeries. So I don't cut through the tendons like in the past people used to take off the piriformis tendon. Now we do a spare approach called piriformis sparing approach, and I don't even cut the quadratus femoris. So we try to spare it, just go and then do the surgery to relieve the to do the joint replacement. So it's a minimal invasive surgery. We can get away with the less than 10 centimeters incision. Most of the incisions are less than 10 centimeters.
Okay, grand. Kamala's also asking is, how do I know I'm at the stage of needing an actual hip replacement? I'm guessing it would be sort of pain or something, would it?
Yeah. Kamala, again, with regard to the stages, it's for me to determine is your pain and your quality of life. And also, if you got difficulty in cutting your toenails, putting the socks, and your sleep is constantly getting disturbed and your ability to walk in a distance is getting less and less, then it's time for you to have a hip replacement.
Okay, thank you. We got another anonymous attendee who's asking, well, their biggest issue is, again, pain at night. And their most effective pain relief is cocodamol. It sounds like they're taking 2 every night. How bad is that? What are your recommendations on that sort of dosage?
Yeah, I'm quite happy for you to take a couple of cocodamol at night, but please be aware it can result in quite a bit of constipation. So it's not a great idea to take it in the long term.
Okay, thank you. Kate McCalgan's asking, oh, yes, it's quite a long one. Is there any research happening with regards to injections into the hip that put gel or some form of lubricant into the joint, basically to help slow down the degeneration, maybe to stop the need for an operation?
Yes, Kate, I mean, there's quite a lot of research going on around the world with regard to injections. Now we have got hyaluronic acid injections, where it's a type 1 collagen that has been injected into the hips, and we also inject into the knees. And there's also PRP injections where they can be used for hip injections, but I cannot see any sufficient significant data to say that these have got significant statistics that can help you in the long term.
Lovely, thank you. Actually, Kate also asked, she's quite active as well, but maybe not to do the high impact sports, but would something more gentle like Pilates and yoga be okay?
Yes, of course, you can do gentle Pilates, yoga. These are all very helpful. Yeah, you can do them. It's not a major concern.
Okay, thank you. Great. So we've got Maureen asking, I've been told I have arthritis of the hip area by a physiotherapist. I've not had an x-ray and have been referred and have been refused an x-ray, sorry. My hip is quite mobile, but I have pain down the front of my upper thigh. Does this sound like arthritis to you, or could it be something else?
I think, Maureen, the important thing is to establish the diagnosis here. So if you got quite a mobile hip and if your pain is not in the groin area, then it is quite likely to be arising from the back. So I think it's important that you see a consultant orthopedic surgeon here or anywhere you like, and to establish the diagnosis. Then once we got the diagnosis, then your condition can be easily treatable with the recommendations.
Perfect, thank you. Now we got Nick asking, so Nick's 56 and he's been told that he's too young to have a hip replacement, but he's in pain and knows he will need one. What are your thoughts? Is he too young?
Again, Nick, I mean, for me, it is establishing the diagnosis. If the radiographs show that you've got advanced arthritis in the hip, it is not unreasonable for you to have a hip replacement surgery because it is your pain and quality of life. I know people are concerned with regard to the age, because my youngest hip that I've done was 32 years of age, a patient who had went for London Marathon, and she couldn't unfortunately walk following this, and she came with the avascular necrosis where the hip has crumbled. So the only way I could get her back on her feet was doing a hip replacement with ceramic bearings, because they tend to give long-term survivorship rather than the metal heads. So in your case, once the diagnosis is established, you're 56, and we got the technology, when it wears off, we can redo it again. And people, I always say them, leave it as long as possible. If you can't, then it's time for you to have it done. And people are apprehensive in recommending hip replacements in young patients is you distribute loads of cycles of stress through the joint, through the artificial joints. So in case if it wears off, revision surgery is a complex, but this can be done. We have got the technology nowadays to do revision surgeries. So it can be doable. So if you're in a lot of pain, by all means, do not hesitate to seek a consultation from the consultant orthopedic surgeon.
Lovely, thank you. We've got Anne Foe, who explains that X-rays are showing that she has, or they have arthritis in both hips and knees. Which is preferable, the hip or the knee replacement?
Normally, if you got arthritis in both hips and knees, my recommendation would be to do the hip first, and then we go for the knee. So majority of the pain, if we do the hip, would also be relieved from the knee. So that's why we tend to do the hip first before we do anything to the knee.
Perfect, thank you. And we've got Todd Elliott. How aware are patients while being operated? I was actually quite interested to learn that I assumed it was a general anaesthetic, but after seeing
It's an interesting question, Todd. I mean, I only had about 3 patients who has asked whether they could watch the surgery while I was doing. We do have monitors in theatre. If they're really interested, we can put the monitor. They can be awake and watch the surgery. But only 2 patients out of several thousand patients I've done have asked for this. But if you don't want to hear any noises, you'll be sedated, And you can also have a general anesthetic. It's not a problem, but majority of these surgeries are done by injection into the back, spinal anesthesia, where they numb the legs and give you some sedation to sleep.
Okay, thank you. Kamala Mowden's back asking a question and asking roughly how long a hip replacement would last.
Kamala, with regard to the hip replacements, nowadays, because of the improved nature of the implants, a majority of these implants, they last 95% of them, they're lasting about 25 years or more. And Quorai Pinnacle that we use here, they've got a good data of showing that their survivorship is about 95% of 20 years.
Okay, thank you. Another anonymous attendee, and actually I think you half answered this earlier, and it relates to the longevity of the joint. If ceramic is better than metal, wouldn't we all wish to have ceramic?
Of course, yes. That's what my practice has been for the last 20 years. I always do a ceramic head on a cross-link poly bearing because I believe the ceramic heads, and the evidence has shown that the ceramic heads do survive, and they have got the long-term survivorship better than the metal heads. Of course, yes, you do need a ceramic.
Okay, perfect. Okay, thank you, Mr.
Thank you
Reddy.
very much.
Well, yeah, I think that's all the questions. So, yeah, thank you. Much appreciated, Mr. Reddy. If we could just move over to the last slide. Excellent. So, as a thank you for joining this session, we are actually offering you 50% off your initial consultation, a callback from a dedicated private patient team advisor, and an email with a recording of the session and further information and updates on news and future events. So we'd be grateful if you could complete the survey at the end of the session to help us shape future events. If you'd like to discuss or book your consultation, our private patient team can take your call until 8:30 this evening, or between 8 and 6 Monday to Friday, using the number on the screen. You can also book your consultation on our website with the discount code HIP50. A link to book will appear once you have submitted your survey response. Our next webinar is on knee replacement surgery, which you can sign up to via our website. So on behalf of Mr. Reddy and our expert team at Benenden Hospital, I'd like to thank you for joining us and hope to hear from you soon. Thank you and good night.
Thank you and good night.
Thank you.